Everyone deserves a smile they can be proud of, no question about it. Don't be ashamed of your smile. Be proud of your smile, and that is possible through Mini Dental Implant Center of Louisville. Dr. Larry Stroud is with us once again, and I love having you on, Dr. Stroud, because I think more people than we realize have some kind of issues with their teeth, whether it be just one or two missing, or if you have dentures that you really want to get rid of, there's a new way, folks. It's less expensive than all of that surgery. It's the Mini Dental Implant Center, and you have been doing it, Dr. Stroud. How many cases do you estimate that you have done thus far?
How many cases? Well, that's a good question. I know that I'm just about to hit 10,000 implants.
Wow.
So I'm learning.
You know, I would think, you know, like you said, we talked about this before, that when you were given root canals, you didn't get a lot of hugs. But when you change people's lives for the positive, and I'm not just talking about physical appearance, I'm talking about eating the foods that you love. If you wear dentures and they don't fit right, you miss having, you know, meat, fruits, nuts, apples, etc. You can do that once again, and it's less expensive than what you thought, maybe half the price. How did you discover Mini Dental Implants? How did you discover these? I know you went to New York.
I was a general dentist for years, and had been seeing things about these Mini Dental Implants, seeing them advertised in the dental stuff. And at the time I was a general dentist, I would see people with dentures, with their lower dentures that wouldn't stay in, couldn't keep them in, couldn't eat, they hurt, have to load all that adhesive in them, caused them all those problems. And at that point, the only thing that we could do is send them to the surgeons to do the surgical style implants, which will work, but it involves going through a series of, you know, pretty extensive surgery, pretty extensive healing, and it's pretty costly. And so checked out the mini implants and started doing some, and it started looking pretty good. So I, you know, learned more and started doing more and doing more. We started doing them for dentures, for the lower denture. That worked good. Then we started doing it for upper dentures. That worked well. Then we started replacing single teeth, a couple teeth here or there. That was working. And so now what we're doing is actually replacing all of people's teeth. For instance, people that wear dentures, we can actually take people from a denture to just have their teeth that just stay in and no dentures anymore, and just a couple visits and nothing too hard. So it's just made the whole process easier. You know, instead of having to send somebody off for a lot of surgery and extensive stuff, I can help them without putting them through too much. I mean, like, you know, my case this morning, I put 12 implants in on a guy, and when I was done, he just got up and walked out and got in his car and drove home after having 12 implants done. I mean, there was no stitches and no bleeding, and it's just a much minimally invasive kind of procedure.
I love that. And I don't know about you folks, but if I'm going to a heart surgeon, I want one of the best, someone who's experienced. And when it comes to Mini Dental Implants, this guy is an authority. He is one of the best, not only in the Louisville area, but in the country. I promise you that. You've been doing this a long time. And I'm glad to see that your business is going so well, because for us as consumers, it's a win-win. It costs less pain, less surgery, less recovery. It's all good. In fact, I want to take a look. Proof in the pudding here. This is a case, this gentleman's name Philip Cox, is that right?
Philip.
Let's take a look. Okay, we've got a little before and after. I love when you do this, because I think it speaks volumes about the effectiveness and the appearance of Mini Dental Implants. So this is Philip Cox. We're going to put him up here. There he is. There's Philip. This is
okay. Here he is, Mr. Cox. He came to me a while back, a few months ago, and Philip had worn dentures for 50 years. 50 years he'd worn dentures, and during that time, he was telling me that every few years his dentures would get loose because the gums would keep shrinking, and he'd have new dentures made. And that's what happens to people. I see people all the time that, you know, their mouth is all shrunk in. You see people with worn dentures for a long time, their mouth is all, and their lips are all wrinkled up and their mouth's all shrunk in. Well, that's what dentures do, because they're moving and rubbing all the time. It wears away all your gum and bone to where there's hardly anything left. And so one of the advantages to doing implants is it helps to maintain the bone that you still have there, so that you don't keep losing your face. So anyway, Philip had lost a lot of bone, and he couldn't wear his teeth at all. And you know, life was pretty miserable. His teeth were so loose, he had to just load it up with adhesive, could hardly get through a meal, hated to go out and eat. His teeth would move all the time. He's real involved in his church, and he's like the devotion leader of his choir at his church. And, you know, so it involved, you know, some speaking and stuff at church, and so it was getting kind of bad, you know, kind of embarrassing. He couldn't hardly talk. His teeth would, you know, want to be moving and slipping and slurring his words, and so he was frustrated over that. And, you know, just didn't have a lot of confidence to go up and speak or anything. So, you know, he came to me and we looked at him, and he really didn't have much bone left. And But we did his case. The nice thing about the mini implants is I don't have to have a ton of bone. I just have to have some bone.
Just a little.
And I've done so many cases where
you're good at this.
Well, I mean, I've just learned a lot doing so much. I've helped a lot of people that have been told, you know, by other doctors and stuff that, you know, they don't have enough bone, they can never do anything, they can never have any kind of implants, or they go through extensive bone grafting to try to have anything done. And so, you know, I've tried to help a lot of people, and I've learned a lot along the way. And so, anyway, he didn't have much bone, but we did his case. Now let's go to his after picture.
Okay.
All right, now there he is now.
Wow.
So it made quite a difference in him. Now what we had to do first was really build Philip's mouth up a lot with his teeth. His mouth had to be filled up. The teeth had to be basically like a lot longer and fill his mouth out a whole lot, where everything had gotten worn down. So now his face is not all scrunched up. He looks more filled out, you know. And he
looks more youthful.
So he's so funny. When I called him the very night of the procedure, when I called him to see how he was doing, he said, Doc, I just want you to answer one question. He said, when will I stop smiling?
I love that.
So yeah, I was laughing over that. I still tease with him over that. So anyway, he was real happy with his smile. He says he's back to eating most stuff he wants. He even mentioned that he's eating apples and corn on the cob. And his wife likes his smile. He says he'll run into old friends and they'll say, something's different about you. What is it? You know, and so he's getting all kinds of good comments like that.
That's
he's
nice.
Enjoying going out again and eating and stuff. And
that's a confident smile there. That looks confident.
You know, and now at church he has a lot more confidence to be, you know, to speaking and stuff in church because his teeth sit still. He says I'm so glad to be rid of that adhesive. He said he told me, he said it's changed my life, changed my outlook on things.
Wow.
So he's you know, after 50 years of suffering with dentures, and now life is better for him.
Well, congratulations, Philip Cox, and that's a smile to be proud of, courtesy of Mini Dental Implant Center of Louisville. If you have a question for Dr. Strout, 571-5263. Perhaps if you're new to the program, you haven't seen Dr. Strout on the show before, a little demonstration. Okay, how do mini dental implants work? I know there's a couple of ways.
Yeah,
if you want to get rid of your dentures, what do we do here?
Well, there's two different things. Let me show you what Philip did. Okay, what Philip did, he has dentures that snap in and out. Snap-in dentures. There's kind of two options that I do for a person that doesn't have teeth or that wear dentures. You can either have dentures that are going to snap in or out. You can or you can have permanent teeth that stay in and you don't wear dentures anymore.
Individual teeth.
In your mouth.
Right.
Yeah, no plate, no nothing. And we'll show that in a minute. But this is the thing I probably do the most. It is the most economical thing, the snap-in dentures, or the dentures and implants. So first we made, you know, Philip new teeth, okay, because his teeth needed to be built up and get the right size teeth and to fill his face out right. And we spent some time getting the dentures made and getting everything looking good first. That's the first thing, before we even make sure the bite's right, before we even do the implant. So when the dentures are made and ready, okay, this is what we did for Philip and what I do for people. Basically a patient will come in the morning, and in one morning we'll put 11 implants in, top and bottom. Now here's the gum. Here's the upper gum, okay? You just have these are the implants. You just have these little things sticking out. The mini implants are kind of like long, narrow screws, okay? But it's a lot different than the surgical style of implants, okay? When a person comes into my office, they're wide awake. There's no putting you to sleep. There's no cutting on the gums. There's no stitches. There's not even any bleeding when we're done. All I'm doing is there's some little pinches where I numb the gum, just regular little Novocaine, just a couple little pinchy things right in the little spots where I'm going to put these things. And then I make these tiny little starter holes that you really don't even feel. And then immediately the implants screw right in through those little tiny holes through the gum, and they actually screw and tighten into the bone. Now there's no feeling of that going on. Everybody says, oh, that's gotta hurt. But really, once I numb that, there's really no feeling. In fact, people kind of get a kick out of me screwing these implants in with a little ratchet wrench thing while they're laying there, and they're aware of what I'm doing. So anyway, all these implants go in. It doesn't take very long. Then here comes the denture that has these little snap-like things.
No more adhesive.
Okay. Has these little snap-like things.
Yeah.
So here's the mouth, right here. Then here comes the denture. It snaps onto the implants. It kind of snaps onto the implants tight. And then the dentures are just there. Now a person takes these in and out to clean them, maybe once a day, but you wear them all the time, day and night. Your teeth just stay in. No more adhesive. Most people back to eating, most of the things they want. Teeth sit still and don't hurt anymore.
Beautiful.
Hold that. Pull on that. You'll see.
Beautiful. Yeah, it's a real snug fit.
It's pretty tight.
And no more adhesive.
No more adhesive.
No more slipping.
Throw that stuff away. People hate that adhesive.
And none of that
Stuff's not
expensive
good for you
surgery.
anymore.
No expensive, painful surgery either.
No surgery.
Love
No
that.
cutting.
All right, if you have questions, we're going to show you the other method coming up here shortly. If you have questions, give us a call. Dr. Stroud will be glad to field your phone calls, whether it's about you, your husband, a friend. 571-5263. We'll be right back on Wave 3 Listens.